Hello. Flexibility of approaches is the most important thing we have to learn to make a good prescription. If we want to be a successful homeopath, we must keep in mind that there is no fixed ways of doing things. Our approach of case taking should depend on the case. It should be according to the case. There are many approaches of finding out a remedy, finding out a similima. Our approach has to be flexible and has to change according to the presenting situation. In some cases, pathology is dominant. In some cases, mind state is dominant. Means dreams, delusion, sensation, emotions, experience of patient, or in some cases, physical generals are dominant. Means what is dominant in the case, we have to give importance to that. And we should treat patient accordingly. In this video, I am going to speak about Dr. Burnett's approach in pathological cases. In cases where pathology covers the whole case, pathology is dominant. Now let us see what Dr. Burnett says. Dr. Burnett says, in some advanced pathological cases, complete cure is not possible without addressing the underlying disease process. He says we have to look beyond the totality of symptoms and address the cause and pathophysiology of the disease. It is not always true that disease is all expressed in symptoms. Means silencing the symptom is not enough. To cure the patient completely, we have to treat the disease process. We have to address the disease process. And to reverse the pathology, we have to look beyond the symptom totality. Now, what is meant by disease process? Disease process means cause, etiology of the disease, plus pathogenesis means step-by-step mechanism by which disease is developed, and structural and functional changes caused by pathogenesis, plus its effect on cellular level and on organism as a whole. All these aspects we have to address under disease process. Then only complete cure is possible, Dr. Burnett says. He further says, relieving the symptoms of the disease does not mean that we have cured the disease completely. For when this has been done, we are only halfway. We have then to ask these questions: what is the real nature, natural history of the pathology of the malady? What caused it? Is the cause still there or has it gone? Means we have to find out the cause. Cause could be anything. It could be microbes or maintaining cause or miasmatic cause. Hence we have to investigate the past history, family history to find out the cause and to address that cause. He further says, a drug chosen should be capable of producing the real disease like one before us. No drug is capable of curing the morbid state homeopathically unless it is capable of producing the one like it in that specific organ. Let us understand this with the one example. Let us take hydrocotyle, asiatica and psoriasis. What is hydrocotyle? We all know it has a marked action on skin and it cures the disorders like interstitial inflammation and cellular proliferation in any part. Interstitial inflammation means it is an immune response, and cellular proliferation is also an immune response which produces a great thickening of epidermoid layer, exfoliation in scales, and produces hypertrophy and induration of connective tissue. This is what hydrocotyle produces. And this is exactly what happens in psoriasis. What happens in psoriasis? the hyperactive immune system attacks its own cells, body cells, which produces inflammation. And inflammation produces redness, itching, and pain. Plus, inflammation also produces cellular proliferation, which cause normal cells to grow faster than their usual rate and which lead to hypertrophy, thickening, exfoliation in scales of connective tissue. Means the morbid state produced by the hydrocotyle is similar to the state of psoriasis, and hence hydrocotyle is a remedy for psoriasis. This is what Dr. Burnett says. He says no drug is capable of curing the morbid state homeopathically unless it is capable of producing the one like it in that specific organ. Means not only the cause we have to treat, but we have to choose a remedy which is capable of producing, which is capable of curing the same morbid state homeopathically. This is what we have to understand. I would like to share with you my case of psoriasis and how Dr. Burnett's approach helped me in that case when I got stuck at one point. A female patient of 39 years old come to me with the complaint of psoriasis. Psoriasis mostly on her soles, largely on soles and minimal on palms, with the thick exfoliation of skin and scaly appearance of the skin, with past history of leprosy when she was in 10th standard, and her presenting complaints are numbness and formication in extremities, mostly on the right side, plus chronic nasal prolonged catarrh, a prolonged coryza with psoriasis. This is case, and I found nothing peculiar about her mind state. So I took these symptoms, I took rubrics, I repertorized the case, and on symptom totality I prescribed her arsiod by considering her presenting state of chronic nasal coryza plus psoriasis. And she did well on my first prescription. My first prescription was arsiod. All her complaints reduced in intensity: formication, numbness, nasal coryza, plus sign and symptoms of psoriasis also reduced in intensity. I gave her same remedy, arsiod, for about 5-6 months. But what happened after 5-6 months? Her all symptoms disappeared except psoriasis, and psoriasis was not improving further. Means her symptoms of numbness, formication, chronic nasal catarrh completely disappeared, but sign and symptoms of psoriasis was still there. I saw no further improvement in psoriasis. So in such a cases, what to do when our well-selected remedies stop acting? Arsiod stop acting further. So what Dr. Burnett says, when a remedy stop acting further, he says it is a stop spot of a remedy. He calls it a stop spot of a remedy. He says almost all the remedies so far used in practical clinical life are of necessity limited in their ranges, and he calls it a range of action of a remedy. Means arsiod stop acting further because limited range of action. So what to do now? I have to prescribe a remedy which will cover the entire range of a disease. I have to find out a remedy which will cover not only the presenting complaint of psoriasis but the past history of leprosy, from leprosy to psoriasis. So by considering her past history of leprosy, I prescribe her hydrocotyle asiatica. And this was my second prescription, hydrocotyle. And after prescribing hydrocotyle, her psoriasis completely disappeared and she got cure within 3 to 4 months. And there was no recurrence of psoriasis since last 1 year. So what we learn from this case? We learn from this case is what Dr. Burnett says: if the range of action of the remedy be not coincident with the range of action of a disease itself, a real cure does not result, no matter how many symptoms you may silence. Miss arsiod did not cure the psoriasis, but it cures the present state, means formication, numbness, chronic nasal catarrh, but did not cure the psoriasis because limited range of action. The range of action of arsiod is not coincident or adequate to the range of action of the psoriasis. He further says, to cure a disease by remedies, the remedies must stand in some relationship to the disease process itself, no matter whether the symptoms reveal the process or not. Hydrocotyle cures the psoriasis because if you read hydrocotyle from Murphy's Nature, in clinicals, what is written there? Psoriasis, leprosy, syphilitic disorders means destructive pathology. Hydrocotyle not only covers the psoriasis but also covers the past history of leprosy. Means it covers the entire range of the disease from leprosy to psoriasis. And also hydrocotyle is capable of producing the morbid state one like psoriasis. We have seen it few minutes ago. And hence hydrocotyle cures the psoriasis. It does not mean that my first prescription was wrong, arsiod was wrong. No. They both are needed and they did their work, they did their jobs. My first prescription was based on symptom totality and my second prescription was based on addressing the disease process. Sometimes we need more than one remedy to cure the patient. When we prescribe on symptom totality, we match the symptoms of remedy and symptoms of patient. And when we address the disease process going there in that specific organ, we have to find out a remedy which is causal or constituent of the same disease process. Either drug should cause the same disease process like hydrocotyle. Hydrocotyle is capable of producing the same morbid state like psoriasis, leprosy. Or it should be the constituent of same disease process. That is no so. Only then a range of action of a drug will be coincident, adequate with the range of disease process. Then complete cure is possible. This is what Dr. Burnett says. He further says a drug to really cure a disease must affect the same or similar part as the disease. It must affect it in a similar manner, and moreover, the range of drug action must be coincident, adequate with the disease action from beginning to end. Then complete cure is possible. Means he says we have to consider three aspects. First is seat of action. Means there must be a organ affinity. A remedy should affect the same organ affected in the disease. Then second is manner of action. Means kind of action. There must be a symptom similarity between drug and disease. And third is a range of action. When we prescribe on pathology, we must select a remedy that affects the same organ or tissue affected in pathology. Plus, it must cover the pathophysiology of the disease. Means pathological changes plus structural and functional changes. Like hydrocotyle covers the all aspects of psoriasis. It affects the skin, plus it covers the pathophysiology of the psoriasis. Means pathological process including structural and functional changes. Means inflammation, cellular proliferation, this is pathological process. Plus structural changes means induration of connective tissue, thickening of skin, then scale, exfoliation in scales, plus functional changes means redness, plus itching, any oozing from that site. This is functional changes. We have to understand the peculiarity of the pathology. It is also very important topic. In some other video I will speak on this. I am sharing with you what I understood and my application of Burnett's approach in my practice. What I learned from Burnett's approach and by reading different books. If you want to understand this topic in detail, in depth, below in description I have given book resources. You can read those books to develop your insight and develop your skill and increase your knowledge. Thank you for listening. That's it.